Hello, my name is Michelle Bender. I am the lead physical therapist and the rehab coordinator for bone and joint care here at St. Joseph East. Physical therapy is an essential component of your recovery process following your total joint replacement. By working with the rehab team, you will have all of the information and education that you will need to literally take those first steps toward a successful outcome. Your recovery process begins as soon as you are out of surgery. Immediate mobility is important in preventing post-op complications. So the rehab team, consisting of a physical and occupational therapist, will typically be in your room to see you very soon after you arrive to the floor post-surgery. If your surgery occurs later in the day and you arrive to the floor after hours, you will be seen first thing the next morning. On the day of surgery, which we call post-op day 0, your physical therapist will put emphasis on your safety with bed mobility and transfers. The first steps to recovery include getting out of bed after surgery and learning to sit and stand from either the edge of your bed or from a chair surface. After you can demonstrate safe standing, your therapist will progress you to walking using the assistive device that is prescribed by your surgeon. Now here at St. Joseph East, the majority of our surgeons will request that you use a rolling walker. The rolling walker is most effective in assisting your therapist to returning you to a smooth walking pattern because the wheels on the walker allow for continuous motion. If your surgeon has placed any restrictions on you regarding your weight-bearing status, your therapist will educate you and your family on those restrictions and will assist you in learning how to walk with those accommodations. Your therapy session on your first day will likely conclude with you being seated in your recliner in the room, and you and your family will then be instructed in the progression of physical therapy activities according to your individual surgeon's expectations. The next day following surgery, which we call post-op day 1, your rehab will progress to preparation for discharge. Your therapist will see you again for additional gait training to improve your tolerance and to make sure that you will be safe for household distances. In addition, PT will work with you on stair training to make sure that you can safely access your own home based on your individual needs. Now, safety with mobility and stairs is very important to prevent falls and to assist in returning you to your independence. However, there is another component to your rehab that is equally important. That component is the exercise program that has been prescribed for you by your surgeon. We strongly encourage you to have a family member with you as you are educated and participate in your home exercise program instruction. It will be very helpful to you to have someone at home to assist you with your exercises because compliance with your home exercise program is a key component in achieving a successful outcome. Now, here is Laura Barnhart to discuss your occupational therapy.
Hi, I'm Laura Barnhart, the lead occupational therapist for the orthopedic floor here at St. Joseph East. During your stay, you will receive occupational therapy to address your basic self-care abilities, home safety, and car transfers. You will learn upper and/or lower body dressing techniques to maximize your independence, as well as follow any restrictions your physician may place on you. There is adaptive equipment available, such as a reacher or sock aid, if your therapist finds you need additional assistance with completing your basic self-care. Now, a primary concern for patients is accessing his or her bathroom. A discussion between you and your occupational therapist will help determine if additional equipment, such as a bedside commode, raised toilet seat, or shower chair is necessary. In addition to this, your therapist will discuss with you the correct technique for car transfers to maximize safety and to protect your new joint. A great tip is to go ahead and push the front passenger seat all the way back and place a sturdy pillow in the seat for those cars that are lower to the ground. To prepare you for a safe transition home, we recommend that you follow some basic home safety tips. For example, all throw rugs should be removed, including carpet runners and small scatter rugs such as those in front of kitchen sinks. Night lights need to be placed in the hallway or bathroom, and all clutter needs to be removed from walkways to create a wide open path throughout the house. Chairs should be sturdy, and please, no rocking chairs, chairs with wheels, or seats that can swivel. You will receive hospital socks during your stay. These socks have a non-slip sole and are great to wear around the house. Please, no bare feet, no flip-flops or sandals during your recovery time. Lastly, having meals prepped and frozen will improve your energy conservation during your first few weeks of recovery. Keep in mind, we encourage a high-protein, high-fiber diet. Again, occupational therapy is here to address your basic self-care abilities and ensure a safe transition home. Here's Michelle to wrap up the physical and occupational therapy section of Joint Academy.
Now that you know what to expect from the rehab team, I would like to thank you for choosing us to provide your care. You have made the very personal decision to improve your quality of life by having your joint replaced. It's now our job to give you the education and the tools you need in order to achieve the greatest outcome. Your therapy team will work together with you, your surgeon, and the nursing staff to make your time with us worth your investment.